Ladies and gentlemen, thank you. Thank you, Professor Rudy. So our old friends here joining with each other once again. As mentioned by Rudy, as doctors, we have to think what the patients need the most. What we can offer is to minimum health, minimum harm. This is a big topic. Now I'd like to talk about this doctor. He published an article in New England in 2003. He's a surgeon, and he was very proud that a lot of procedures were created by him. However, he published a comparison study last year for the early stage prostate cancer. There are 3 groups. The first one is active monitoring without any interventions. And the second is the prostatectomy group. And the third is the radiotherapy. For 15 years of follow-up, there's no statistic differences of mortality. So he asked a 50-year-old man. He has expectancy life of 30 years. If you use the prostatectomy or radiotherapy, there will be irreversible effects. How he can spend the other 30 years. So that's the question to the surgeon. Traditional surgeon using the open surgeries, even robotic surgeries. So Fred is a great doctor. No matter how advanced he has technologies or techniques, he put the needs at the center of his treatment. So on the May 27th, Friday will come to Chongqing. We will talk about the minimally and non-invasive surgeries. He also thinking about the surgery development. Surgery is developed by Westerners. However, this word should be redefined. In before, surgery talks about results. It's about open cut, put people down. However, there should be a new version. Less is more. And that should be the new version. The less is more. So that's something we should redefine surgery. This is a new thinking. We should bring more benefits to people and less harm. So that gives rise to the focused ultrasound ablation surgery. This is not a philosophy only to China or to the world. It is open to doctors around the world. It is the same as doctors do to minimize the harm. And it can do that. We can have this focused ultrasound, and it was very targeted. The other tissues around the target will not be harmed. This is the technology. What we should do to promote this technology, to unleash the benefits, we should learn this technology better to avoid the harms it may cause. There's no best solution. There's only suitable solution. Is HIF non-invasive? HIF is only a technology. It's not just the definition for non-invasive. We can compare the knife, blade tip, blade handle, hilt, and for the HIF knife, there are 3 also components. And for the blade handle, it's ultrasound, non-invasible. And you can see the blade tip, it's the focus of the power energy. An instant second, the lesion can be treated. The hilt is also visible. Altogether, we can see it's an invisible knife. So from outside body to treat lesion inside body to see things inside body is very important. In the past 20 or 30 years, so we have technologies such as the grayscale showcase and the MRI temperature map. They have their own advantages, these two methods. However, in treating tumors or in treating brain tumor, the MRI monitoring is also great due to this great man. Coverell Hallinan is the founder of the MRI guidance for monitoring, and he lays out the foundation. As a doctor practicing and as a scientist, you can see there's an editorial, and this editorial says we should establish long-term safety and efficacy and cost-effective treatment devices that are not reliant on online MRI guidance must be developed for broader accessibility. Real-time monitoring should be fast, should be working with the blade tip. There are some insufficiency for MRI mapping. However, ultrasound lags behind the MRI in imaging, especially the contrast of MRI of ultrasound cannot be compared with MRI. So today, we are going to talk about the past, present, and future of focused ultrasound. I think we have to mention the very basic concept. We put ultrasound together, target the ultrasound is not a sonic target. Well, it's actually the biological target. So when the sound or sonic applied to the biological body, the body will react. That's the tip of the blade. It's not the sound itself. Some people never think about it before. So the tip I want to mention, the tip is actually the lesion of the biological body. It's the biological focused region. It's not acoustic focused region. They are related to each other. So they are the intensity, time, the structure, function. There are over 20 varieties. So we have to understand the true tip is the biological focused lesion. Therefore, the real-time response is very important. And for ultrasound, we can see the grayscale, and for MRI, we can see the temperature. They have their own advantages. We're marrying the merits of the two methods and put them together for next year and the year of the next. And the ultrasound can monitor the temperature in the near future, and especially the real-time temperature on the targeted area. So this is my own prediction. In 1 to 2 or 3 years, it's quite predictable. If more temperature can be monitored for ultrasound, it can be really real-time monitoring. But anyway, we should pay tribute to MRI because of the temperature monitoring. So I saw equipment from Incentech. It's about the Parkinson's treatment to treat lesion inside the brain. The focused ultrasound is not property to any company. It's a property to all human beings. So the traverse two hands are traveling. We asked the patient, which one do you want to treat? The left hand or right hand? The patient said he wants to treat the right hand. After this 48 seconds of irradiation of the focused ultrasound, the hand will not travel, and the left hand is still traveling and shaking. So we also did this with the help of MRI monitoring. It's still quite useful. After 48 seconds of irradiation, the hands didn't shake. I believe it is the results that we cannot imagine brought by science. 48 seconds solve it all. However, there are some difficulties. 48 seconds of irradiation, but the whole surgery process took 3 hours. The time it took is about the targeting, adjusting, and doing the calculations. So we have to talk about the future development. We never deny the use of MRI. What we are thinking about is the future prospects. So by sharing these slides is about the biological focused lesion. It's actually the blade tip. On that basis, we invent the HIFU blade. So from 1999, 25 years have passed. The National Museum of China had collected the original equipment of us. This first equipment was retired and it was very old, and you can see the picture. It is collected in the National Museum of China as an exhibit and a milestone of history. So please, everyone, GC300 or GC400, we have this technology, the infusion of imaging. So there are some problems in the ultrasound temperature monitoring. So in the in-deep body, the MRI is very great, better than ultrasound. So it took 3 hours of treatment time. Why? MRI does not respond immediately compared with ultrasound. So for monitoring, we actually align the MRI and ultrasound. So this requires practice, response, debugging, adjustments. So after several rounds of this, we will improve this technology to make it simpler and more efficient. I think the alignment process may be difficult or challenging for you, but I believe in the near future we will make it easier to use. We have to feedback to our engineers, hardware engineers. We should improve this. And doctors, please use this equipment so that we can have feedback. So this dynamic alignment accurate rate is only 20 to 30%. For example, when we treat the patients, when the breast or the uterus moves, we can track the movement. The accurate rate is not high enough, but after 1 year or 2 years, we believe the accuracy can be increased to 80 or 90%. So please use this, help us improve. Our dream. We hope. This is the result, the ablation. Okay, the membrane is protected, the outer layer is great, and there is no single open cut. Well, I've been talking about this picture for 10 years. Every time I talk about it, I'm excited. For open cut surgeries or laparoscopic, there are holes. We think it's reasonable, legal, all right. However, we do not have any other way. But if there's technology, there's no cut. We can use HIFU blade, only some high temperature lesion. That is only the adverse effect for HIFU. If there's a lesion caused on the skin, but for open cut surgeries, the holes are normal and reasonable, that's not right. Well, these are some patients and cases. After our treatment, the women can conceive again. There are a lot of HIFU babies. I hope to see more. It's not about the technology, it's about the concept. Well, you can also work with hysterolaparoscopic surgeries combined with the HIFU. And Rudy may talk about the adenomyosis treatment. So it's my first time to hear the speech from Rudy. You're a surgeon. You do very well the laparoscopic surgeries. What you are challenging? You are challenging yourself, Rudy. So he can actually use this technology to treat patients. The technology is enough. However, Professor Ruby talks about what benefits can he bring to patients. Even he is a so experienced expert, I admire him. Well, we both challenge ourselves for the patients. That's the cause we pursue. I admire the spirit. Well, there's another doctor, Savaraja. Speaking of the fertility, well, the birth rate in some developed countries are slowing down. How about those who cannot conceive? Well, Dr. Savaraja treat patients to help them conceive, have babies. What's more admiring is that he promotes his concepts and techniques to more and more people. For example, in 2022, he had a training course during COVID-19. It was very difficult. However, Dr. Savaraja managed to make it. We look forward to see more HIFU babies. That's about the future population development. So sitting here is also include doctors in breast specialty. Rudy said that we have to listen to the patient. This is artist Matsushika. She had breast cancer. She had mastectomy. After she wake up, she said that she's not a complete woman. So she took this picture and published this in 1991 on the front page of Times. Well, challenging the doctors whether the breast can be saved. So to this century, our doctors champion the breast-saving surgeries, and uterus-saving surgeries is also prevailing now. HIFU is a solution. For example, the breast cancer before and after treatment, and this is the combined therapy, and we can also treat breast fibroadenoma very fast. This is a collaboration of the whole world. This technique belongs to the humanity. For example, Professor Ava Kwong and Professor Michael Duke, they had a seminar in Nanjing, spending 5 days in China, Nanjing. They explored how the focused ultrasound can be used to save the breast. On that day, there were 20 or 30,000 audience doctors. It was really a scene. So many people. I was very attentive. we save organs, we minimize the harm. That's the original aspiration as doctors. We are seeing that we are going back to the original aspiration when we became doctors. So the picture of artist Matsusuka will be realized. The guidance for application were published in 2005, the very first one. Dr. Safa. So to preserve the facility, we should have the guidance as well. And this is also an expert consensus on these techniques. Now we have 5G. We can do remote surgery. So Dr. Sun Yonghua did it very great. So doctor had this remote surgery and surgical room, operating room. So and this is the distance over 1,000. The doctor was in Chongqing and the patient was 1,000 kilometers away in Inner Mongolia. The procedure was done before. Patients and doctor are in the same operating room. However, with 5G, we believe the whole Earth should be a mega surgery room, operating room. So the whole way of surgery will be revolutionized. This is the result of technological revolution and the needs for human well-being. There are two societies. The ISGE the International Society of Minimally Invasive and Virtual Surgery. Next year, we will have the 6th international event in Chongqing. We welcome you to join us in Chongqing next year. And the next will be the future prospects, the all-in-one diagnostics and treatment.
到轻度微创手术，再到微无创巨颈脱身心容手术的发展过程，对患者的损伤越来越小。聚焦超声心容手术是从体外发射超声波，聚焦于的周围组织，在小地区产生。
This video shows the mechanism of the focused ultrasound.
对焦点区域以外的组织无损伤。颠覆性的全新治疗方式，在21世纪已经产生。进去，经过20多年的积淀，基于大数据的聚焦超声心容手术，结合最新影像科学技术，已经进入一个智能化的数字诊疗新时代。数字解剖可以立体展示患者的局部解剖结构，大大提高诊断的准确性和治疗的安全性。数字病理可以使我们对许多做出快速准确的病理诊断，避免传统冲刺病理带来的损伤和副作用。数字诊疗让治疗变得更简单、更安全。从诊断到治疗，让患者获益最大，其中得到最大限度的保护，诊疗竟变得前所未有的轻松。这个时代正在到来。
现在数字化病理。
So this is a digitalized solution. Pathology. 卞修武 academician is leading the team to do the digital therapeutics. So this is also a result already with an accuracy of 78%, 87%. That will be all. Thank you.
Thanks for Professor Wang's speech.